All right, we are live.
Awesome.
Nice. So we are on day 24 of the Sage Circle Alliance, what I'm calling the month of May marathon. Every day we're here right at the same time uh, to talk to our founding members and have, some eye-opening, off-the-cuff, unrehearsed conversations about plant-based health, how to improve our business placement, uh, and to talk to charter members about joining the Sage Circle Alliance, which is a fabulous organization that's just getting off the ground. Today we have with us, well, let me introduce myself. My name is Meryl Fury. I'm a registered nurse, and I am one of the co-founders of the Sage Circle Alliance. You will see on my little name field there, it says CIO. We'll tell you about that later. And with us today, we have Paul Chatlin, who is my BFF in the WFPB world. He is co-founder and CEO, and he'll tell you about that later. And then we also have Anthony Masiello of Love.Life Telehealth, who's one of our founding members. So grateful the two of you are here. Really.
Thank you, Meryl. Yeah, me too. It's
Thank you.
awesome to be here with both you and Paul.
Yeah,
We
totally.
feel the same way.
Yeah. So, just for gigs, why are you the CEO, Paul?
It was not a title that I selected, but it was given to me, and I seem to wear it well, which is the Chief Empathy Officer.
Yes.
And
Because Paul
just,
is a sweetie, that's why.
just to let people know, that sweetie came into play when I had heart disease, when I realized that the world didn't revolve around me, and that I needed to treat myself a lot better with making better food choices. And then I needed to treat people better. And I developed this idea that I've become, for 12 years, a one percenter. And what is a one percenter? I believe the good in everybody. I don't care what's going on this planet, on this world, individually, politically, it doesn't matter to me. I believe good will always triumph. And I look at people like that. And even if they do wrong, I believe that they have always a chance to rewrite that wrong and have it a better outcome. And, I can't say that everyone that I've met along the way believes in that stuff. I think there's still a lot of angry people, but I think there should be a calming. And the way to do it is through compassion and empathy.
Great. Thank you. That is why he is the Chief Empathy Officer. And we have this running joke that he is the lover and I'm the fighter. That's how that works.
Now, Meryl, I'm even more curious to know about what your CIO stands for.
Thank you for asking, Mr. Masiello. The CIO is the Chief Interdependency Officer or Chief Interdependence Officer. And so in that role, and I take that on really seriously, is that we are about getting everyone's input, encouraging contribution from people. Paul and I are not interested in being the heroes or the people with all the answers or the people who are always, well, we do drive the bus, but not always. We don't want to always be the one, pushing and pulling people along. We love to hear what other people have to say, and that's what interdependence is about. Everybody has an equal say. Everybody has an equal opportunity to contribute, and that's what that is. And that doesn't have a whole lot to do with me being a fighter, except that I will fight for somebody to get their opinion out. I will, pull it out of a person if I have to. That's what that is.
That's awesome.
Yeah. So Anthony, introduce yourself. What you up to?
So I'm Anthony, and years ago, I founded a company called Plant-Based Telehealth. We were acquired a couple of years ago, and now the name is Love.Life Telehealth. And I'm on this mission now, and I have been on this mission now for over 5 years to help make sure that everyone has access to a doctor who practices medicine with the prevention and reversal of disease in mind, with a lifestyle first approach, meaning empowering their patients to take the best care possible of themselves, and then using pharmaceuticals and other therapies as a backup when something within that plan doesn't work. And that's kind of the purpose behind Love Life Telehealth and what we're aiming to do. And in doing so, I have the tremendous privilege of connecting patients with 8 of the most incredible physicians that I've ever met. You know, there are a team of doctors who combined can see patients in all 50 US states. So we have the country covered, which means anyone within the United States and also anyone internationally can have an appointment with one of these doctors. And they also can look at the root cause of any illness that they're having, or if for healthy people, they can look at their diet and lifestyle and they can try to make some fine-tuning adjustments now to prevent things like heart disease and diabetes and other conditions from ever becoming an issue for them.
That is so
Noble.
noble and important and powerful. And thank you.
Thank
Yes.
you. Yeah.
Yeah, totally.
I have a question. I'm warning people, I will be asking a lot of questions. So here's a question for you, Anthony. Like, if it's factual that if you eat a plant-based diet, that you'll become healthier.
Yeah.
Why is it that it's such a struggle to see it on TV, to have it shared with general practitioners when people come in to see them? Why is it such a challenge when the science has been there for 20 years and been talked about a lot more in the last 10 or 5? What's the challenge? Why is it not where it should be?
I think there are 3 major challenges. The first is that people either don't know or don't believe that it's possible. And when I say people, that includes people who are sick, that includes people who are healthy, that includes doctors, that includes nurses, that includes many dietitians. They either have not read the information or the literature and they don't understand it, or they just don't believe it, or they kind of have a hunch. But I think that's obstacle number 1, is that people don't believe it. No, number 2, I think this is an even more complicated obstacle, is that people don't want to believe it. They don't want to hear it. People want to do what they're used to doing, and they don't want to believe that they've been harming themselves by following their family traditions, or that they've been harming themselves by going for convenient choices and fast foods and very palatable, delicious, tasty products that they have on the grocery store shelves. And number 3, which is equally as big of an obstacle, is that change is really hard. And we all know, and I think that the 2 of you can agree with me on this, and probably many of the people watching, that living this lifestyle and eating a whole food plant-based diet is not really very hard. Like, in fact, it can be enjoyable, pleasurable. I borderline saying fun, because of the great people that we get to have community with in doing that. But the process of going from a standard American diet to a whole food plant-based diet, I don't discount for a second that it's a challenge to make that kind of a change. And those of us who have been motivated enough and have been kind of consistent enough to have made that change and come out to the other side, I do think sometimes that we forget how hard it is for others to just do it. So that's where I feel like your empathy and the compassion and everything that we can apply that way to help lead people, draw people, support people through that difficult period of change, so that when they come out the other side, then they're healthy and happy at the same time. Because I don't know, most people think that they're going to be, yeah, I might be healthy, but I'm going to be miserable, and I'm not going to have any friends, and I'm not going to be able to do anything that I used to do, and I'm not going to be able to enjoy birthday cake or like all of these things, which isn't the truth. So I think, yeah, we've got a lot of work to do. We've got to really, I mean, so many of us, including the 2 of you, are leading by example and showing people that number one, we're answering that first obstacle. We're showing people, yes, it does work. I mean, Paul, you're talking about heart disease. For me, I'm talking about hypertension and migraine headaches and sleep apnea and obesity. I was morbidly obese, right? And all of those things are gone. And Meryl, I hope you didn't have any major health concerns. I don't know, but 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 we know so many people who have recovered from those health concerns and are completely medication free and are living a really vibrant and healthy life. So we have those examples. And yeah, and number two, we need to help people to show them that the change is worth the effort, and that when you come out the other side, it's actually, it's fantastic, it's beautiful, right?
Yeah. I think there's another layer of it too. It's a deep question, right? Like you could go down
Yeah,
that bunny hole for a long time
yeah.
talking about how difficult it is or what stops people from changing. One of the things I think that in this country, of course, we are confronted by and in a constant, like, the image that's coming to mind is like that fire hose of misinformation and marketing that keeps us strung, tied to these hyper palatable, convenient foods. I was watching Facebook this morning, the ritual, wake up and turn on Facebook, right? So that's what I'm doing in the morning. And there was a little short video of, I don't know if I sent it to you, Paul, or not, but it was a video of a guy in a suit, looking very official. Dare I say he's a white male, so he has even an additional layer of officialness, and he's talking about how, it's very tongue-in-cheek, about how we call this soda or pop, but it's really liquid candy. We are selling you liquid candy. It's just got bubbles. And he's going through this whole thing, very straight faced, right? Very like flat expression, very deadpan kind of thing. And just the idea that we sit and we listen, and we go with the children are awash in this information that is totally lies, fabricated, right? And then when it comes time to, oh my God, I just had my first heart attack. I just got diagnosed with pre-diabetes. Now I've got early stage kidney disease. Now I've got this. Now I've got that. We never, ever, ever once think that is about our diet. And then you go to the medical community and they don't necessarily suggest it in any believable way. They might say, well, you might want to take the salt out of your diet, which is like painful. Or, so I worked in public health for a while, and a lot of our clients were from Central America. And they would say, well, you're going to have to stop eating all those tortillas. Like what in the heck? You know, I think our society is set up to keep us in this situation. There's no.
You know what, Meryl? It's so interesting you brought that up, and I'd like to almost move my laptop to my desktop to show you. I write an open letter when I have something I hope interesting to talk about. The heading of my next letter, and it goes in stages. I think about it. I write a little bit about it. I hold on to it. I play around with it. But the heading is Twizzler licorice, fast food and pills. Oh my. And the reason was I woke up in the, early this morning, the TV was on. And what I saw was those three commercials in a row. And immediately I thought to myself, wow, like think about that. They give you the Twizzlers licorice, then they do a fast food commercial, and then they give you pills. So basically, to me, I thought it was interesting that
Right.
like they're saying, and by the way, it never ever stops. So in the world that we currently live in, you're inundated with information that isn't always fact checked, and that's in the political world, whatever it may be. I'm not going to get into that, but just whatever it's like, I'm going to just tell a bigger story to grab a bigger headline, and then everyone wants to be bigger and better about it. And then when you go home and you put TV on, you never ever, 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 ever see, hey, by the way, if you eat these foods, this is what's going to happen. And we're not making this up. This has been fact checked. You will live a better life. You could get rid of your pills. You could stop being in pain internally. And it's like, I kind of now understand it more than ever why people are so resistant to change when they are the only ones that will truly benefit. Because as Anthony had mentioned, like I saw the before Anthony pictures, and I wish I would have known you then, because you're not the Anthony then that you are now. No way. And I'm certainly not the person I was that I am today. And I will say that at 66 years young, I almost feel guilty that I feel so good almost every single day. I'm not saying every day's perfect, but like, my people, that my friends, like, wow, all they do is another pill, another complaint, another issue. I'm like, man, I don't want to hear this crap anymore. Like, just change your lifestyle. But as Anthony said, and I do agree, lifestyle change is tough on every level. First of all, it's on your own personal level. Okay. You grew up eating a certain way. And I laugh, Anthony, because I always tell people, you love your beef, right? You love your meat. So, okay, why don't you eat it without putting stuff on it? Just eat the meat. And like, oh no, I gotta smoke it. No, I gotta put tenderizer on. No, I gotta season it. I gotta marinate it. I said, well, then you don't have to do that with apples, fruits. You don't have to doctor it up. You just eat it. You know what I'm saying? So it's like, I understand how difficult. Go to a restaurant, go traveling. It's difficult. You got to plan. But when you add up all the inconveniences, what you and you accept them, what you get is the best you could be as you get older.
Yep.
Easy decision.
Yeah, you just have to give yourself time to get used to it. That's all. I mean, how many young adults, and this is a kind of a sad example, like have to learn to like the taste of beer, right? Like the first time they drink it, they probably like didn't like it, but you keep drinking it anyway, and eventually it becomes something that a lot of people, really enjoy, right? It's the same thing. Or I watch this tradition of, you give the baby a birthday cake on their first birthday. And it's so funny because the baby's usually in a high chair, and it's usually a whole cake made for the baby. At least that's kind of how it worked around here when our kids were young, and we would go to all these different, kids' birthday parties. And you put the cake down on the high chair, and the baby just starts like playing with it and touching it, and like it doesn't know what to do with that birthday cake, right? But then, eventually sometimes it's the parents, take some of the icing and put it on the baby's lips, or sometimes the baby accidentally touches their face, and you see that change, right? You're like, wow, and then the next thing you know, the baby's trying to shove in as much cake as possible. Like, that's learned behavior, right? And sure, it's easy because it's sweet and it's birthday cake, but we can learn the same kind of behavior for, I chase seasonal fruits, and not even exotic seasonal fruits, but I look forward to sumo oranges in the winter, and I look forward to persimmons in November time, when those are coming out. And I can't wait for it to get hot because the watermelon is going to be so delicious, and we're going to have strawberries all over the place up here in New Jersey. And then, and then in the fall, a nice crunchy apple, or my favorite, pears. I just love like fresh pears. So like, we learn how to. It's just different. It's not better. It's not worse as far as the enjoyment or the satisfaction. It's just different. We just have to give ourselves time to kind of explore that and get used to it.
What's interesting about that is that when I was asked on the gurney, would you make a lifestyle change? I didn't know what it meant when I said yes. I had no idea. I just said yes, no surgery, yes. And then I said on the way home, like, okay, dude, you just committed to something you didn't know. What does it really mean? And then I spoke to Dr. Esselstyn that morning, and he explained, I go, like, literally, holy shit, like, I'm in trouble because I don't like vegetables. Like, I'm not a bean pea guy. Okay. I'm not, I don't like them. Right. And then I said to myself, listen, you can do anything if you have to for 30, 60 days. Okay. So I said, 60 days, I'll do it. So here I was. Can you imagine? Like, this is angry Paul, right? Not empathy Paul. I'm eating a thing of broccoli. I'm like, cauliflower, beans, and then I did it the next day, and I'm like, the 10th day, but something happened. Like around the 14th day, I'm like, that's not so bad. Now, do I love them? Nope, still don't. But I almost like them. And guess what? Almost liking something has allowed me not to have any surgery.
It might have even kept you alive,
It might
right?
have, yeah.
Regardless of surgery, yes
Right.
or no surgery, but it
Yeah. I mean,
life.
it's like, I don't know. I don't want to say that like a weakness or anything like that for people, but it's like, man, if you have a chance to feel like a kid again, and all you have to do is just not change everything you eat, but just change different things, knowing your taste buds will change. Why not?
Right.
So I have a question, because you were talking, Anthony, about how Love.Life has doctors that could span the country as well as go international. And that is certainly needed, probably like 2,000 fold of what you're offering right now, right? Everybody should have access all the time. So, like I said, I was a public health nurse for 30 plus years. And one of the things that was seriously missing in the arena, or the neighborhoods where people don't really have access to anything beyond the local public health clinic, is that and access to fresh food. There's a few things, but that's certainly two of them, right? So for the average telehealth business, can patients use their insurance if they have it, or is it more of a concierge or a cash basis?
Yeah, so it's both. It's a cash pay system, and we provide the documentation so that people can submit for insurance reimbursement on their own. And I'll say a little bit more about that. So the problem with the current medical system is it's the entire system, right? It's not necessarily that your doctor wants to spend 4 to 6 minutes with you. It's that in order for your doctor to make a living, they have to see 10 patients per hour. Right. And at Love Life Telehealth, our shortest appointment is 30 minutes. And the sometimes the preferred appointment is an hour, depending on what someone needs to work on. So we're trying to keep that as affordable as possible. The appointments are $175 for 30 minutes, and it's exactly double that rate, so $350 for a 1-hour appointment. And I know that that's not accessible to everyone, and we are going to work to make that change. We literally cannot afford to lower the prices, but what we can do with some hope and with some evidence is we can hopefully influence the insurance companies to show them that covering this kind of care is beneficial to the patient and to the insurance companies, because it will save everyone's money over time.
Right.
So patients book their appointment, they pay upfront for their appointment, they meet with their doctor. Their doctor documents the appointment just like any other doctor would. They include all of the diagnosis codes that the patient, that they can apply for the patient. They include the treatment codes, and then we have all of the doctor's information. So after the appointment, we give the patient what's called a super bill.
Right.
And the patient can take that super bill and just send it in without doing anything to it, send it right into their insurance company for reimbursement.
Mm-hmm.
And that's where it gets really complicated, because now so the first thing it depends on are your diagnoses. So if you're a healthy patient, your insurance company might say, well, for a wellness checkup, that shouldn't be a big deal. I'll reimburse 20 to 25 bucks.
Sure.
Right? But if a patient has 2 or 3 or 4 chronic diseases, especially 3 or more chronic diseases, which is unfortunately not too unusual today.
Right.
Meaning, if someone has high blood pressure, they've got type 2 diabetes, maybe they're overweight or obese, you've got some. Then there are other things that people are suffering from, and they can be included. Then you get into a reimbursable category that would likely reimburse the full amount of 175 or even 350 for an hour-long appointment. But it's still complicated because then it depends on your insurance plan. So it depends if the patient has out-of-network benefits, and it depends on if the patient has met their deductible for the year. So we really couldn't even get started if we were trying to accept insurance up front, because then we would actually be accessible to many fewer patients, because we wouldn't be able to support a 30 or 60-minute appointment, unless somebody is very, very sick, right? Or has a lot of complicated conditions. So it is, I can honestly straight face say that this is the best that we can do at this time. And my dream is that we're going to collect enough information so that we can start to show insurance companies, look, patients paid, X number of dollars, whether that was 350 or 525. They had X number of appointments with their doctor. They paid $525. They had 3 appointments with their doctor. Now they're off of these 3 medications and basically saving their insurance company $9,000 per year. Right? If we can start to show that kind of return on the investment for these appointments, then I think we can get reimbursement up front so that patients are not having to pay out of pocket. But again, that's a really long road ahead of us to be able to get there. And that's not just true for us at Love Life Telehealth, that's true everywhere for this kind of care. And it's going to be even especially more challenging to do nationally, because we will literally have to negotiate those terms with every single insurance provider that every single patient that comes to us has.
Right.
So I know you're in the medical field, so you understand how complicated that is. And we probably would have been working on this for more than 5 years and not even had one patient seen.
Right.
If we tried to start this way. On the flip side, we've had over 3,000 patients that have been seen in the past few years. And we've got an incredible number of success stories where people are living the kind of lives like what Paul is describing, just feeling great. And we're happy that we can be there for them, during the process.
A couple of things. Let me add one thing and then ask you a follow-up question. To me, it's funny how when I got on Repatha, the cost of that drug was $600 for 2 shots a month. And the advantage was that it was the first cholesterol drug that was not going through the liver, and I didn't have the side effects that I had with Zocor and Lipitor. But it's tough sometimes to justify the cost. But on the flip of that whole thing it was my health. It was like, okay, so maybe I won't go to a movie, or maybe I won't buy that next pair of pants, or like it's life is about choosing trade-offs. So I wasn't like I was rich. I just had to make different types of decision. But it seemed like I always believe people should lead with their health, because once they don't have their health, what are you going to enjoy? So that's just a little side thought. Now, here's my question, Anthony, for you, which is, let's say that you found a bottle on the beach, and it was a little dusty, so you rubbed it off, and a plant-based genie came out and said, listen, generally we give 3 wishes, but we're compassionate. We're going to give you 2, because I think 2 is enough. And along with that, we're going to ask you a question so that you could wish for any 2 things for you, Anthony, or anything you want. But then you need to describe something that is upsetting to you that you wish would change. So would you answer that for me?
Yeah. Well, the most frustrating thing to me is when I see the kind of deflated feeling or the defeat that I see on people when they learn that they've got a health condition that they wish that they could get rid of. And So for me, my wish is that people understood how much of their health is in their own hands and can be determined by the choices that they make. Because I truly believe this, and this is said with compassion and empathy for the world. I believe people don't think that they have any control over how healthy they are. I think people think that illness is inevitable and that everyone is going to die of either cancer or heart disease, and that along their way on their path to either cancer or heart disease, it's totally normal to become obese. It's totally normal to develop type 2 diabetes. and so if I could wave one wand, I would want everyone to understand that they can they can seriously impact the health with the choices that they make. And I think that's going to make things much better for all of us in this industry, because we're going to not have to spend so much of our time convincing people that we can help them, and we can actually then shift our gears to actually helping people and kind of serving them, and helping them to optimize their health and wellness.
Okay, so
Well, wait, I have a quick, oh, go ahead.
that was your first wish.
Okay, well, let's get Meryl's question in case or comment on that one, and then I'll go on to a second wish. That's a big wish, Paul.
It is. It's pretty huge.
You're on a big show with some
Yeah.
big people. It's a big show, big people. Big
We're
wishes.
gonna do it.
All right, so here's my question, just in relation to that. I realize that is a wish, right?
Yeah.
I get it. Now, if we bring that back to actual current life, real life, there are whole sections of the population who don't have access. That, like I said, I worked in public health and in areas where there was no access to fresh food. People were shopping in the local gas station.
Yeah.
Right? That's where they were getting their food. I appreciate we're talking about wishes right now, but the wishes won't help that population right now, right? So in a realm where you're working with telehealth, going back to the reality of it, what do you see could be done for people who don't have access in the way that I just described?
Yeah. The one thing that we've explored, and we actually have implemented this to a very, very tiny scale, is that we've had other generous people create who wanted to donate appointments for others.
Mm.
And we've even had patients who have done well and they wanted to kind of pay it forward. So they've made donations into an account, and then we've been able to use that for to provide free appointments to other people. Because unfortunately, this type of care is expensive, and mostly it's expensive because physicians should be fairly compensated for their knowledge, the work. I mean, these doctors work so hard for their patients that they, and in this world of lifestyle medicine and practicing with whole food plant-based nutrition, it's hard for them to make a living as well. And I'm not talking about buying their second boat or something like that. I'm talking about the same things that everyone else is dealing with, right? So that's one thing that I think could be done. The problem of doing that on scale is that needs administrative support as well. Because what we can't have then is people trying to exploit that system and trying to use it unfairly, and having people who don't want to pay for their appointments trying to get their appointments for free, rather than helping people who cannot afford to pay for their appointments. But I do want to back that up. And I do live in an area with a supermarket, and I have always had a car, so I've been able to drive to the supermarket. But I learned, for me to make the lifestyle changes that helped me to lose 160 pounds in just 20 months, and to get off all my medications in about 3 or 4 months, and to develop a new vigor for life, I spent $11. I bought a book. It was Dr. Joel Fuhrman's book, Eat to Live. I read the book, and the difference in what I learned after the fact, the difference in what I did and what the other millions of people who have purchased that book did, is I did exactly what that book said to do. And and anyone out there can do that. You can go get your favorite. I mean, there are much more current books now. That was back in 2005, right? But you can get a more current one of Dr. Foreman's more current books. You could even go back and get the same book I read, Eat to Live, if you wanted to do that. And then let it be simple. Bananas are some of the least expensive food that there are, right? And they last pretty well, especially if you go to the store and there's a variety of yellow ones and green ones, and you can get a whole bunch of bananas. And dried beans, I've been cooking all of my own dried beans, for the longest time. But beans and rice and even oats, and then whether you can get some other fruits, frozen fruits, or whatever's in season, like buy apples when they're affordable, by other things, by watermelon or melons, cantaloupe, things like that, even pineapples. Some of them are not very expensive. I mean, they get expensive when they're chopped up for you and they're put into those containers. But when, like, I literally buy a cantaloupe, I cut it in half and I take a spoon. I mean, I get rid of the seeds and I just eat the whole thing out of the cantaloupe, like that. And it's not expensive,
Right.
To do that. So it's, yeah, it's hard. And for people who are on medications, there's not going to be any doubt. I did not have a lifestyle medicine doctor or plant-based doctor when I was making this change, but I logged my blood pressure every single day 3 times. And I went to my doctor and I took this paper and I said, this is what my blood pressure is doing. And she said, oh my gosh, I have to adjust your medication. Right. So I went there and I used my insurance, to do that. So there are ways to do that. And then, so I don't know if that answers any question or if that really addresses any issue. But again, if people really believed what was possible and believe that they have some control and people want to do it, we can usually find a way, to kind of make it work. I do believe for most people, because this isn't involving, fancy testing, and this isn't involving like these advanced labs that are costing hundreds and thousands of dollars. Like most of the conditions that people are suffering from today, I mean, people really just need to eat more vegetables and eat more fruits and
right?
eat more whole grains. Like if that's the one thing, and I do believe most people have access to be able to do that to an extent. And I don't say that lightly when I say I believe. There are very well people who may not be able to do that, and I respect and appreciate that as well.
Yeah. Thank you. All right. Go ahead, Paul.
By the way, if people are strapped financially and they don't want to eat fruits or vegetables, I mean, what are they going to eat that's going to cost the same? I mean, what I'm saying? Like, you have a choice. You could eat little healthy or little not healthy. I mean, okay, another story. So now you've got another wish, and you've got something that you don't like that you wish you could change. It's not a wish. It's just something that frustrates you at this moment.
That everyone doesn't have access to fresh fruits and vegetables.
That's a good one.
It's your wish.
It's true, because the two go hand in hand, because I believe that if people understood the impact that they could have on their own health, and they truly did have access to delicious, whole, fresh fruits and vegetables, then I think the world could be a happier place.
All right. And then
if you give me a third wish, it's going to be
I don't.
like then I would want to take care of me so that I could better help others. But I think these are good ones.
See, now everybody who's watching this is living proof of the type of people that are part of the Sage Circle Alliance. And I've said this, that everyone so far that we've met, and there's like a lot now, are all nice, kind people who think of others before they think of themselves. I thought that we would reserve your frustration, that would be your personal frustration.
Oh, yeah.
So please share with us what is frustrating, because we're humans. We're happy, we're sad.
Yeah. I'm a pretty happy person. I've got a healthy family, and all that is going well. So for me, it's just like, in order to accelerate this movement, I wish I could figure out how to reach more people and basically enroll more patients in Love Life Telehealth. And that's the challenge that I face every day is, but and it's two-sided, right? It's because I want to help people, and it's because I respect and appreciate these doctors, and I want them to have all of the patients that they each wish, so that I could bring on even more doctors to help to really build some momentum behind this movement.
You know, it's interesting you say that, because as the founder of the plant-based nutrition support group, I totally get it. You know, more money gives me more employees. More employees means I get a further reach. But I will say something that binds us all, and I'm going to just take a moment to explain this. Like, so you've got these great, and I know all your doctors. You've got these great, qualified, compassionate, smart physicians,
Brilliant. Yeah.
coaches, nutritionists. You got the whole gamut of health. You give this person 30 minutes to an hour, and you're invested in this person. And what I would say to everybody, and I say this because Love.Life is a founding member. The Plant-Based Nutrition Support Group is a founding organization to the SAGE. This is why we have the SAGE. And what I love is that Anthony and I have had longstanding mutual respect, where, you know, he recognizes that when a doctor finishes that 1 hour, or your doctor finishes your 10 minutes, he writes a script, or he gives you a list of things to do, and then you're gone for a month or a year or a while. And where do you go? And now this is something that I am passionate about, just like with Meryl and the young kids. And by the way, what Meryl's passionate about with the young kids, we could do a full hour or day on just by itself, the unfairness of it all. But what I love about Anthony is he recognizes that they need help. You cannot make a lifestyle change without support. And you can't afford to have a doctor by your side every day for 60 days or 30 days. And that is where I feel, just like you, honored that while we're still the only support group on the planet for continual plant-based health support, that I'm able to partner with you. So your doctors are saying, hey, listen, I'll see you in X amount of days, a week, 2 weeks, a month. But if you need support, more education, more camaraderie, sign up for a whopping $10 a month and join the Plant-Based Nutrition Support Group. And I bring this up only because we're doing these 30 podcasts for 30 days. And the reason why we're doing it, okay, people, I'm going to admit something. I don't do it because I love it. Okay, I don't. I mean, you know, it's I've told everybody, it's a day killer. It's 1 o'clock of the day. I do it because I'm committed to the idea that if we could bring in more professionals, more entrepreneurs, and build this up as a true alliance of like-minded people, that what's going to happen is it's going to benefit Anthony's organization, Meryl's wish to improve children's health, the Plant-Based Nutrition Support Group, and every health coach, every lifestyle medical doctor, every nutritionist, anyone, our web design. It's going to help everybody within the alliance. So that is why we're doing this for 30 days. That's why we have Anthony with us today. And that's why Meryl and I, that's what we wake up thinking about every day. So just, that was my little commercial.
Thank you. Yeah.
I want to go back to Meryl. You have other questions, I am certain.
That's okay. Okay. Yeah. So you talked about insurance companies. So I feel like I always have to sort of preface what I say. I spend my days thinking up questions, and so this could go on a long time.
Oh, great. Yeah.
I will not torture you longer than the hour, but I have a lot of questions. So,
I got his phone number. I call him after the meeting if I have more questions.
All right, you and I, we can do that. All right, so you were talking about working with people and developing a body of data and statistics that you could take to your insurance companies or the insurance companies at some point further on down the line, and explain to them, show to them, demonstrate the value, the efficacy of lifestyle medicine for preventing and reversing illness, for stopping these massive, crazy, ever increasing costs of healthcare in America, right?
Yeah.
Okay. I worked in the insurance realm briefly after I was after I spent my time actually going in and out of houses in the public health realm, right?
Wow.
Visiting
Yeah.
people and all that and working in clinics. Well, then I was like, okay, I'm kind of done with walking around the gangbanging neighborhoods that I was in. It's a little stressful. So I'll go into insurance, right? Equally stressful, but just in a different way. And what I saw in those environments, they do not appear to be any more interested in stopping people from getting sick.
Right.
So, two questions, I guess. If the goal is, or somewhere down the line, you'd like to be able to prove to an insurance company that lifestyle medicine is actually valuable and worth reimbursing, but somewhere in there, they don't really care. Somehow, I'm not quite sure what the connection is that they don't care. You would think that they would. They don't seem to.
Yeah.
How do you see getting this information and delivering it to insurance companies as being beneficial? Do you have that figured out?
No, we don't have it figured out. And in my early conversations, and mostly, to be fair, my conversations have been with self-insured companies. So these are companies that
Yes.
also operate as like an insurance company for their own employees.
Right.
And it comes down to the return on the investment.
Yes.
And they implement wellness activities at their companies, and they look to see what kind of return they might be able to get on the money that they spend to roll out these wellness initiatives, right? The thing that I most often see is they go for pretty inexpensive initiatives, and so there's not a necessity to see a big return on the investment. Like, and for one example of, let's say, a very affordable, let's say, initiative that a large company might implement is they might give everyone in the company a pedometer,
Yeah.
and then they create a step challenge.
Right.
And they want to see, they want to get people out walking. They want to encourage people to go for a walk during their lunch break. They want to encourage people to take the parking spot that's furthest away from the door rather than one that's the closest. They want to encourage people to use the stairs rather than use the elevators. And they're willing to spend, whatever it is, $2, $3, $4, $5 per employee, to get one of these little devices that people can clip on their pants or clip on their belt or hold in their bag to see that happen, right? But if we want to talk about reversing, let's just say, type 2 diabetes, it's going to involve a little bit more than a $3 investment in each employee, right? We know that the average cost of a type 2 diabetic to an insurance company or to a self-insured company is about $14,000 per year. That includes medication, that includes doctor visits, that includes everything that the insurance company has to pay for a diabetic patient versus a non-diabetic, or a healthy non-diabetic patient, right? So we need to come up with a system that we can offer a solution that costs much, much less than $14,000 per year, because of course we're not going to get that whole $14,000 benefit the first year, because it might take 6 months or more to reverse the type 2 diabetes. So in the meantime, the person, the employee in that case, or the insured person, is doing both, right? Now they're getting this, now they're participating in this program that the company is paying for, and they're also, going to their endocrinologist, they're also getting their medications. So they're actually costing more for the first year, probably. And then if they come through and then their diabetes is controlled, or they ramp down their costs, then that company can get the benefits in years 2, 3, 4 down the road. But it all depends on the insurance company or the self-insured company, what type of time frame they're willing to accept for that return on their investment. And let's just be completely open and honest. If a company has high turnover, there's a risk that they're going to spend the money and somebody else is going to get the benefit, because if they only keep employees on an average of 1 to 2 to 3 years, then they don't have enough time to recoup what they've spent. Doesn't mean it's a bad initiative. It just means it's not a self-sustaining initiative, and it's not something that the company may actually be able to afford to do.
Mm-hmm.
So It is very complicated. I think everyone, and I think it's a problem, you know, that everything has to be looked at as the return on the investment, but that's where the whole entire system comes into play. And quite frankly, I think that that system has gotten us to where we are today, and it needs to change. But the systems this big that are all intertwined, you know, it's the entire healthcare system, it's the entire it's the entire healthcare provider system. It's the entire healthcare payer system, which is different from the providers. That's the insurance companies. And then also it's the food systems, because now we're, you know, like they're all linked up together.
Right.
And
Well, it goes further than that, right? It's the pharmaceutical system. It's
yeah,
the
yeah,
it doesn't stop. It is all
yeah.
intertwined. This
Yeah.
is what we have a podcast which we will be launching called Sage Talk for Wicked Problems.
Mhm.
That is a wicked problem.
It's a big
Right.
one. Yeah.
Yeah, it's a wicked problem.
So the best that we see people do right now, and this is what I understand Paul did, this is certainly what I did, this is what I believe you're doing, Meryl, is the best that we can do as individuals right now for a grassroots, from a bottom up movement, is to get out of the system.
Mm.
And unfortunately, that costs us money too. But I'll tell you, like, I've been paid back in multiples from that, you know, from my $11 investment in that book.
Right.
Or quite, you know, then truthfully, I bought a lot of books since then. So I'm in this for several $1,000s as well, even though I didn't have the personal guidance of a physician who can help to guide me through these steps. But and truthfully, I know that we all are. But the difference is I see that as a very worthwhile investment. And I know that it's been, I mean, I was denied a 20-year term life insurance policy when my wife was pregnant with my son. My son's 18 years old now, right?
Wow.
That insurance company didn't think I was going to make it. My oldest turns 20 next week on June 2nd, and my youngest just turned 18 on May 2nd. So I might not have been here. So you can't measure that in a dollar for dollar ROI, but I think I'm worth a little bit more alive than I am dead. And certainly I wasn't willing to accept that at a young age of 33.
It's not personal. You are just a stick. You're just a thing. You know, like everyone. It's not personal to anybody. But you know, actually, this is interesting for those people who are in this realm, be it animal compassion, planetary awareness, human health, because I think each one in those sectors that makes up the SCA all feel that way, which is I want to make a world of change, but the only thing that I can make a difference is one person at a time, that old grassroots idea. And I used to always say, no, it's not enough to just do one person at a time. Let's make a big splash. But it hit home for me when I got a call from the head of medical at General Motors. I'm like, wow, this is big. And they called because they wanted to hire us to help them reduce the sickness of their retirees.
Wow.
And it was their third biggest cost in the billions as an organization, right? So we're like, oh my God, if they say yes to this, then everyone will follow General Motors. And then we could move this needle a lot faster. Who knows where we'd be today if that were to happen. Yeah. We spent about a year, and I brought in Dr. Furman and Dr. Neil Bernard. They worked together as one to help develop a program along with 4 local doctors. And then we got a chance to present it at the highest level. And remember, they took us a year and a half, hundreds of hours of our work. And at the very end, they didn't have what it took, the guts to say yes. At the end, they decided maybe we're not ready for this. Like maybe it might be too much for this. In the meantime, their cost keeps going up, right? So what I'm looking at for your sake and Meryl's sake, definitely my sake, is like, who's the entrepreneur out there that has the stones or the non-stones to say, I want to make a difference and I'm not waiting any longer. That's it. It just takes somebody to commit, because individually we got a whole bunch of transition great success stories, but we still haven't gotten that one.
Yeah.
They're out there.
There are champions out there, and there are people who are pushing for this stuff, and I believe it will snowball. And so when people are successful, the other thing that I encourage them to do is share their experience,
Yeah.
share their stories, share it publicly, because decision makers need to see and understand and know how this worked out in those isolated cases, even if it's not statistically significant. We just need these examples to even help to give other champions or kind of sleepy champions, the support that they need to just push these things over the line and get them going.
Right. It's interesting. I would say to people that one of the good things about COVID was that it taught older people how to use Zoom and StreamYard. And now I
Yeah.
can add, it allowed your organization to be more relevant, where people from anywhere in the United States could reach out to you for help. And I would be the first one to stand in line to endorse the quality of care you get when you reach out to love.life.
Yeah. Yeah. Thank you, Paul. I appreciate that. And I agree.
You
When we started, it was before COVID, and we weren't anticipating COVID. And we thought we had two obstacles. We were going to have to help people to understand that telemedicine is a legitimate way to deliver licensed medical care, real, true licensed medical care. Like the doctors do prescribe medications when it's necessary. The doctors do order lab tests when they're needed. And we can do that anywhere in the country. But we thought it was going to be hard, but COVID erased that obstacle for us. Everybody knew out of necessity that that was fine. Now we still have that second obstacle to help people to understand that lifestyle medicine is a real evidence-based approach to treating and managing disease. And that one we're working on, but people are listening.
Yeah, it's pretty funny, isn't it? That I got a call from my cardiologist at the Cleveland Clinic, and he's like, "Paul, I haven't seen you for like 9 years." I'm like, "Hey, first of all, every year I send you all my information, so you got it. You're a call away. I eat plant-based." He says, "Yeah, but you're the only patient I haven't seen in 9 years. I need to see you in Cleveland Clinic, or maybe I'm not the right doctor for you. Can you?" I said, "Dude, let's Zoom it. Let's StreamYard it. Okay, you can't touch me, but you got all my vitals, right? I mean, come on." But that's the example of kind of backward thinking here. Really, you don't need a doctor to look at your ear or look up your nose or look down your throat. You could do it virtually. Literally, you could do this all virtually. And if you have a problem, that's a different story.
Yeah.
But we're here to make
for most conditions, and for most chronic conditions,
Right.
absolutely.
Yeah.
That's what it's an information exchange, and it's guidance, and they're reviewing labs, and they're doing that. But the doctor will be the very first to tell a patient if there's something that they cannot responsibly do by telemedicine. If you require a stethoscope, you need to listen to someone's lung, you need to diagnose an infection, those kinds of things, you have to do that in person. There's no question about it.
Right. Well, listen, we appreciate Meryl. I would just say that, Anthony is a perfect example of somebody who believes in the Sage Circle Alliance. We're honored to have you part of what we're doing, and your doctors.
I'm honored to be a part of it. Thank you. Yeah.
Thank you. And I just want to say, you're a friend, but somebody I truly respect, and it's somebody I promote to my friends and family. And the competition's growing. All of a sudden here in Michigan, where I live, there's 2 or 3 new lifestyle medicine doctors that could just do it in Michigan only. So
Yeah.
This is not just a phenomenon that you own; it's happening everywhere.
And I think the great thing about that is that that's going to just help to legitimize it, and more people are going to understand that it's possible, and more people are going to get care with this kind of support, and that's going to help everyone out. Like we're all going to grow because of those things. So we're supporters of everyone.
And you just described the Sage Circle Alliance. That it's funny because some person said, "Well, you got 8 health coaches part of your organization." So I'm like, everyone's different. I said, everyone's got their bio and their information. You could choose who you want. And we got room for 100 of them. Why? Because we got 350 million people here. Like, you know what I'm saying? We got room, and people are so worried about like competition. I love competition because it raises us all up. That's what it does.
Yeah. There's also, I think Silas Rao said the other day when I was speaking with him, either you're collaborating or you're competing. And our goal is to collaborate. You know,
Yeah.
there's this idea of competition, but that is such the old paradigm. Like Paul said, there's multi-millions of people, and there's no shortage of sickness in this, not in this country and not in the world. There's no shortage. We'll never run out of sick people to take care of, certainly not in our lifetime.
Yeah,
So,
and think about it, Meryl. It's like when somebody says, "Hey, I live in Wyoming, Paul. I need a doctor." Love.life, and as soon as they finish that consult, it's, "Hey, let me funnel you right back to PBNSG." And what did it? Sage Circle Alliance, and this is how it rolls, just like that.
Yeah.
Yep.
So,
well, let me get us wrapped up here. We're at the top of the hour. Everybody has something else to do. I'm sure Anthony's busy. I know Paul just sits around and does yard work when he's not doing this.
no, I'm just on podcasts, and I'm at your service.
I know. Thank you, and I appreciate that. But for people who are interested in learning more about the Sage Circle Alliance, our website is going along in the ticker space on the bottom, sagecirclealliance.org. We have an amazing website built by one of our founding members and his team, which has been amazing. Brian Denstedt put in a lot of time and effort in there. There's across the top of the homepage, there's the little navigation tabs. You can scroll down the page. It says either join us or become a member. There's little buttons you can click all up and down that homepage. Click on one of the buttons, check it out, pick out the size of membership that fits you just perfectly, and sign up. We are just a group of people who are passionate about making a difference for human health in the most economical way possible for the long haul, not just to get you through the next illness or over this next set of symptoms. And we are also really here to support the whole food, plant-based, healthy, vegan, animal compassionate, people who are worried about the environment, those entrepreneurs, change makers, and thought leaders. That's what we're here for. To keep those businesses afloat so we can make a difference for the rest of the planet. That's what we're here for. So if any of that rings any of your chimes, checks any of your boxes, go to the sagecirclealliance.org and check it out.
Right.
Paul, parting comments, and then we're wrapping it up.
Yeah, and Anthony, my brother, thank you as always.
Thank you.
We're gonna always lean on you, but you're strong.
Great. We'll do it together. We're all stronger together.
That's right.
Yep, I love it.
Thanks
Thanks again. All right. Have fun, everyone.
All right. Great talking to you.